Over the past 2 years, we have been working with DFID and the Southern African Trust to develop a cross-sectoral database for ex-mineworkers in the Southern African region. This is quite an innovative project that was focused on looking at ex-mineworkers, but also current mineworkers, and some of the challenges that they face in accessing unpaid claims.
The challenges we faced were numerous. Many ex-mine workers did not know about their rights to medical benefit examinations and compensation payments.
The systems that were in place were not working. The IT systems were not working. People have to do these processes manually. We didn't even know whether we're doing repeat payments or not. But then we realized that the same mine worker who goes through the Medical Bureau for Occupational Disease and the Compensation Commissioner to claim his benefit, he also has got outstanding unclaimed benefits in the retirement funds.
The lack of coordination amongst the key stakeholders that are firstly holding these funds, which are the compensation and social security funds. The second aspect is linking them up to the mining communities.
That has been a problem, particularly where a foreign mine worker was working for different mines. How do you then reconcile or even try to trace or even track the benefits that were payable and due to those mine workers?
We then decided that I think it's important that an information management system that can pick up that if a worker has got a claim, we can check with other areas whether he doesn't have an outstanding claims in those areas. That's where the principle of this cross-sectoral database came into the picture. We have issues regarding the identity of ex-mine workers, their industry numbers and their dependents.
And the families, when they come to know that they will get money, it becomes a very huge dispute.
It was 2003. Lapho khona kwashona mage. Sasuka ekhaya labe sihlala khona. Sahamba sayohlala ekhaya elikhulu. Kwathi 2006 lapho khona wagula khona kakhulu nje kwabonakala ukuthi uyaphathekile. Kwathi up until 2007 lapho khona kwakhona kumncoba. It was 2 February. Kusaqala nje umnyaka. Nokwasenda ukuthi nekufunza ungasabi kahle esikolweni. Ngobe kwasekina leso simo sekuthi akasekho lo sinakako manje.
When mine workers exit the industry, we don't have a system of having to locate them and know their whereabouts.
One of the rhetoric that we normally get from most of these mining companies or even the insurance institutions is, we don't know where the mine workers are. They're here at Bolam. We know where they are. In Molepole, right now we're in Molepole. We know where they are. Bako le Pepe, bako Ntlwadibi, bako Tamaga. We know where they are.
Ni kwathote ne ke kopana le tsone ene le tsa gore ke neka ka tsana go etelle ke tsama mo mekgathong ene ba re ba ka nthusa. Ke sa bone sepe. A be gata boithobo mo go nna. Ha ke ta go kopana le Bolama.
Jano, bontsi ba batho bana ga bana dipampiri tse di supang or documentation that proves work in the mines. Is that a lot of them are not knowledgeable on the rights that they had or on the right to access or right to compensation or right to claim their social security benefits.
Ha ke tsena mono ke sena go nna le bakanyana. E be mpoelela TV ye. Ya ntshwara go le bothoko. E be ke ya go robadiwa mo hospital ko Scottish. Ha ke tswa mo be ke ja dipilisi go ithella 6 months. bolwetse bo bo nkamile tota mme bo nkamile ka gore ke maoto a gana.
This project was not only focused on finding ex-mine workers and having their details updated and facilitating their claims payments. It was also about a collaborative approach together with the other Social Protection Fund administrators, but also a massive awareness-raising campaign.
So we grouped up with the HealthFocus, Banking Association of South Africa, the Medical Bureau, and the retirement funds to contribute to the making up of this cross-sectoral database.
So linked to this was an innovative tracking and tracing process, an input that we made in providing decentralized services called the one-stop service centers. We have 4 in South Africa, and we have 2 each in Lesotho, Mozambique, and Swaziland, and 1 in Botswana.
The industry on numerous occasions. They have done roadshows, and these roadshows have been all over SADC.
The Mineworkers Provident Fund coming out from Johannesburg into Eswatini in the rural areas, identifying ex-mine workers, dependents, and then completing the necessary paperwork. We have seen some of the money unlocked from the Provident Fund.
We were able to bring together 5 Social Protection Fund administrators to design a system that could identify at quick reference if a mine worker or an ex-mine worker was due compensation to multiple Social Protection Fund administrators.
Most importantly, we now have an integrated database that links the compensation fund with pension and provident funds.
The database that we are in possession of right now is the platinum industry, is the gold industry, and is for medical compensation.
The service delivery announcements that we introduced meant that we paid out approximately 700 million rands to 29,000 beneficiaries in Southern Africa over the last 3 years. 200 million of this went to beneficiaries in the Eastern Cape, and a further 200 million went to beneficiaries in Lesotho and Mozambique.
So for the first time in the history of Botswana were able to do benefit medical examinations.
People are much more aware not only about the process for claims, how they may go about doing it, so it's the right information being available at the right time and being delivered by the right people.
People are standing up, people are not sitting down and waiting for manna to come from heaven. That's huge. That excites me. Actually, even talking about it just excites me.
So I think through this project and the coordination from HealthFocus has been to really address the barrier that is there where miners can actually submit claims. There's a process and the documentations are checked and the miners are assisted, and HealthFocus has been able to then process these claims, follow them up, and ensure that these miners are able to get their benefits.
Wasi 2016 now yakuphela kwaba khona imali yababele sihle ngiyithola ngikhonile 20 driver's license ngakhona kuvula mobile money kulo mobile money lengimvulile ngivulele kusita abantu basemangweni
yalo madi abulangwa na re thusa eno anentwano kana palo ke sekwele go sehetsa a heila ke dikile ke motsentsa sekweleng se bidwa nan polo se se madi a manitsi a heta 10,000 me kana ka kolota hela ka kolota ibile ke a isa a solo edi me re hela ya ka tswa ko madi a o ke nna ke duela batho ke ba ke mo eleletsa aba a hetsa ba kwala.
Now the project was not without its challenges, but we managed to overcome them.
The databases have not been effective, nor have they been shared with the miners' associations. You know, we are expected to be the ones going, tracking and tracing them, and yet we are not getting, the assistance from the insurance companies and the compensation institutions.
In order for us to work well with it, we need access to that reference database. We need to know what documents have been already submitted and which document is still outstanding. So then with that, we can be able to help the ex-mine worker.
During the course of the tracking and tracing, there were issues around cultural or socio-dynamic issues that came up. These issues need to be taken into account with policymakers and those that are designing programs in the future. And I talk especially to the Shiyamisu Trust that has been set up.
Shothi lengakusho nje ke kulaba labasebenza ngalama Mineworkers. Asebanakisise ikahle kahle eqinisweni lonke ukuthi lo mdali ushone anebantwana labanganani linani labo bakhona ukuhlukanisela labantwana ngalokufanele ngoba lokhu umcoka kakhulu ukuthi wonke umntwana lokhona akube khona la kutholako kungabe ukuthi khona lo tawusale abalisa ngemuva.
The Social Protection Fund administrators need to be able to have systems that are interoperable so that when information is updated on one system, the systems talk to each other.
We are now exploring computer-aided diagnostic tools that will help us in terms of eligibility criteria for people to enter the system based on the databases. We are also linking up with biometrics in terms of ID documents, passports, fingerprints and facial recognition software. We're using computer-aided diagnostic tools in chest x-rays, as a computer-aided tool will help us to say whether the chest x-ray is normal or tuberculosis or an other occupational lung disease.
In conclusion, what I would like to say is that information sharing is what is vital and paramount to moving forward with accessing and unlocking unpaid claims. By this I mean that information needs to be shared throughout the continuum of the claims process. Finally, we must not forget the individual. So we need to have systems where when individuals cross borders, change telephone numbers or addresses, they can easily contact the different Social Protection Fund administrators and update that information.